Today's topic is about varicose veins. We will be discussing about the anatomy, pathophysiology, clinical signs and symptoms, diagnosis and finally treatment. First, let me start off by telling you that this topic is crucial to master for undergraduate surgical posting. The percentage of a case of varicose vein being asked in exam is as high as 85% to 90%. Before you study this topic, you must master the foundation. What is the foundation? The foundation is the knowledge of anatomy of the veins. So, let us very quickly revise that piece of knowledge. I cannot find a creative common image for the normal anatomy of the leg veins, so I have included a link in the description so you can click and view the image. My advice is open the image in a new tab. Look at the image simultaneously with the video. If you observe the leg venous anatomy, veins which are close to the skin are known as the superficial veins and the veins away from the skin are the deep veins. The superficial vein and the deep veins are connected via perforating vein. Therefore, blood flows from the superficial to the deep system through the perforating veins. 85% to 90% of the venous return occurs in the deep system. And because these are veins, they are equipped with valves to prevent backflow of blood from the superficial to the deep. This is the normal anatomy. Understand this piece of information first. Now, assuming you have understood the anatomy, it will be very easy to understand the mechanism of the disease. In varicose veins, the valves in the perforating veins become dysfunctional. The most frequent area for this is at the intersection of the saphenous vein and the femoral vein in the inguinal area. In this case, the saphenous vein is an example of a superficial vein and the femoral vein is an example of deep vein. When this valve is dysfunctional, the saphenous vein enlarges and the distal valves and femoral vein gradually become ineffective. What happens then? The saphenous vein and its tributary veins eventually become ineffective as a result of the dilated vein. Since the superficial veins are closer to the skin, the incompetent veins are typically more evident in the calf area. This is the reason why many patients seek therapy when their calf veins are noticeable. You must also know the risk factors related to this condition. The first risk factor is age. The vein valves that aid in controlling blood flow deteriorate with age. After the valves have worn down enough, some blood can eventually flow back into the veins and collect there. Next factor is gender. The illness is more likely to affect women because female hormones tend to relax vein walls. Hormonal changes before a menstrual cycle, during pregnancy, or during menopause could be a contributing factor. Varicose veins could also become more common as a result of hormone therapies, such as birth control tablets. Pregnant mothers have higher incidence of varicose veins. The next is obesity. In obesity, vein pressure is increased when a person is overweight. The last factor is prolonged standing. Lack of movement causes blood to pool in the veins. Usually professions like traffic policewomen are at risk. Now let us study the clinical symptoms and signs. This is a very famous clinical question too. Superficial varicose veins can lead to nocturnal cramps, ankle edema, superficial thrombophlebitis, and hemorrhage. They can also induce heaviness and exhaustion after prolonged standing. When performing a clinical examination, you must look for any surgical scars which will tell you about any invasive procedures being done. The next thing you look for is the presence of venous eczema. It is usually itchy and red. You also need to look for venous ulcers which are big, having shallow depth and undefined borders. Look any skin changes which signify the inflammation of the subcutaneous fat. It is known as lipodermatosclerosis. Finally, you can also look for the Saphenous varix, which is the enlargement of the saphenous vein at the groin's intersection with the femoral vein. I have put a link to an article about varicose veins on how you go upon answering that station in clinical exams. Do check it out. The next step is to confirm your diagnosis. In clinical setting, the best diagnostic procedure for detecting valve incompetence is duplex ultrasonography, which has to be applied to all patients exhibiting symptoms. The other method is plethysmography, which evaluates reflex in the superficial and deep system, however it plays a little role in the assessment of main varicose veins. If the examiner asks you to state one method to confirm varicose vein diagnosis, your answer must be duplex ultrasonography. Next is the treatment of varicose veins. I am just giving you an overview, not the fine details of each procedure. The overview is sufficient for undergraduate medical student to answer the question of treatment. However, if you are interested, I have included resources for the details for each treatment in the description. So, let's talk about the treatments. One of the treatments involves stripping of the saphenous vein. What is the meaning? The meaning is that the saphenous vein is removed using the stripping procedure, which exposes the vein at both ends before removing it by guiding a metal or disposable catheter up the vein from the ankle or knee. Next is saphenous ligation. The saphenous reflex can be eliminated by ligating the femoral vein and the saphenous vein. Usually it is indicated for patients with proximal saphenous veins that are larger than 1.5 centimeters. The next one is endovenous closure with radiofrequency ablation or endovenous laser therapy of the saphenous vein. In this method, the saphenous vein below the knee is accessed with a needle utilizing ultrasound guidance. A radiofrequency or laser catheter is then inserted into the vein, and the catheter is used to heat the vein after being passed up to the saphenofemoral junction. Heat causes collagen to contract and thromboses the vein, which causes it to close. The other method is microincision branch vein excision, or also known as stab phlebectomy. In this method, tiny incisions are made to visualize the saphenous vein's tributary branches. Then the branches are then cutted out using clamps, tools, or crochet hooks. The resulting scars are minuscule and almost undetectable. As usual, there are quiz questions. Pause this video and answer them. Comment your answers below. As usual, please like, comment and subscribe if you find this video useful, as this will motivate me into doing more videos like this. Don't forget you can request your biology or medicine topics via the Google form that is linked in the description below. Thank you and see you all in the next video.